Hi, I'm Dr. Thomas Piorkowski, and in this presentation I'm going to give you 8 steps that you can take to lower your blood pressure without the use of any medications or pills. Before we get into the actual steps, let me give a brief layperson's introduction to what is blood pressure. Blood pressure is literally how hard your blood is pushing on the body. When your heart beats, it pushes the blood around the body, and then that blood has to actually push on your body to force oxygen and nutrients into the tissue. If there's too little pressure, then the blood will be unable to donate that oxygen and nutrients into the body. In fact, might not even be able to circulate properly around the body. And that is a condition that doctors call shock. On the other hand, if there's too much pressure, then the body can start suffering long-term pressure damage from that excess pressure. And that can cause damage to the brain, to the heart, to the kidneys. In fact, any organ in the body can start suffering from damage from long-term exposure to high blood pressures. Besides the pumping action of the heart, there are other factors that can cause changes to the blood pressure. First of all, the content of the blood can alter the way that pressure is distributed through the body. If your blood is thin and watery, it will not exert much pressure. But however, thick, sludgy blood that needs to be pumped very hard through the body can exert a lot of pressure, and many of the steps are about reducing the thickness and sludginess of your blood. Our blood travels in blood vessels, and the walls of these blood vessels should be thin and easy to push against in order to force oxygen and nutrients through them. However, if they become irritated and inflamed, or thickened or scarred, the walls can become thicker, and that will force the blood to exert more pressure to force oxygen and nutrients across those blood vessel walls. So some of the steps will also address the need to reduce this irritation, inflammation, and thickening of the blood vessel walls. Well, the most dramatic step you can take to lower your blood pressure is to quit smoking if you're a smoker, and by that I include cigarettes and marijuana and anything else you might be smoking. Smoke contains a lot of chemicals and tar, and that thickens the blood, which makes it harder to pump, so that increases your blood pressure, irritates the blood vessel walls, causing them to go into a spasm, causing more blood pressure, and it makes it more difficult to force oxygen and nutrients across the blood vessel wall, forcing your heart to pump harder, forcing your blood pressure to go up. Smoking anything causes high blood pressure, so if you want to lower your blood pressure, you can stop smoking and your blood pressure should drop. And I've cured quite a few patients by focusing on the cigarette smoking and getting them to quit cigarettes, and I was able to cure their blood pressure just by getting them to stop smoking. So that's an important step to take if you have high blood pressure and you are a smoker. Step number 2 to lower your blood pressure is to don't drink anything except water. And even if you're drinking water, preferably distilled or purified water. Most commercial drink products such as your fruit juices and your sodas have a lot of sodium and sugar. Both of these cause the blood to become thicker, forcing the body to suck in more water to try and dilute the blood, which fills up your blood vessels and causes the blood pressure to rise. They also irritate the blood vessels, forcing the body to pump harder to get oxygen and nutrients across the blood vessel walls. Alcohol also irritates the blood vessels. Coffee and tea can cause the heart to pump harder, raising the blood pressure. This is especially true if you have multiple cups of coffee or tea during the day. 1 cup of coffee or tea in the morning probably won't cause a problem, but some people are very sensitive, and if you have very high blood pressure and you want to lower that blood pressure, you should probably avoid coffee and tea. In other words, to avoid the caffeine that's in that coffee and tea. You can perhaps switch to a decaf type beverage. Even tap water is rich in sodium. That's why the seas are so salty, because all that water that flows down to the sea has salt. Then the water evaporates and leaves the salt behind, and that makes the oceans quite salty. So tap water is rich in sodium, which is salt basically, and salt thickens the blood. So most drinks, pretty much everything you drink, will contribute or can cause high blood pressure. And what you want to do is you want to avoid that sodium, that sugar, that caffeine that causes the blood pressure to rise, that alcohol that irritates the blood vessels. You want to just drink pure water. And by pure water, I mean either distilled or purified water that that pure water will, in addition to not giving you extra sodium, it will actually wash out sodium and sugar in the blood, helping the body to be purified of sodium and sugar, reducing the sodium and sugar in the body, and therefore actually causing your blood pressure to reduce. So that is another step you can take if you want to reduce your blood pressure. Cut out all the liquids except for distilled or purified water. I mentioned in the previous slide you should avoid commercial soft drinks and sodas and fruit juices because they have sugar in it, and sugar is a blood thickener and a blood vessel irritant, and that causes your blood pressure to rise. But eating sugar-containing foods causes the same effect. So if you have food in your kitchen that contains sucrose, fructose, corn syrup, dextrose, or maltodextrin, then it's probably better for you to stop eating those foods if you want your blood pressure to drop, because all those ingredients can cause high blood pressure. Now, these refined sugars are most commonly found in manufactured food, so when you're out shopping, the easy way to discriminate is to decide, does this food come from a factory or does it come from a farm? You won't find boxes of cookies or chocolate bars hanging from chocolate bar and cookie trees on the farm. They're actually made in a factory, so you should avoid those and rather focus on things that do come from a farm, such as your apples, your pears, or oranges. You can eat sweet things that come from a farm because natural sugars don't have the same effect as refined sugar that is added artificially to products. You can also perhaps switch to products that are sugar-free, so sugar-free cookies, sugar-free chocolate, and so forth, to avoid that sugar, because that sugar is going to irritate your blood vessels, thicken your blood, and raise your blood pressure. So remember, real food comes from a farm, not a factory. Try and eat real food with natural sugars that are not going to have these irritating effects on the body. Cut out the sugar-containing foods so that you can lower your blood pressure. The next thing you can do to lower your blood pressure is to avoid salt or sodium-containing foods. Salt is sodium chloride and it releases sodium into the body, but many foods contain other forms of sodium as well. Sodium is a blood thickener. It causes your blood to become thick, and then the body has to force more water into it to dilute that sodium, and that raises your blood pressure. So if you want to reduce your blood pressure, you need to get rid of the sodium that's causing your blood to become thick. It's very commonly used as a preservative in many factory-made foods. So again, when you look at food, think about it. Does it come from a farm or a factory? If it comes from a factory, look at the ingredient list and make sure that it doesn't have added sodium. It probably will have added sodium, and you need to cut out those added sodium foods in order to lower your blood pressure. The next step is to use exercise to stay young. The reason for that is that as the body ages, blood vessels naturally become stiff, thick, and easier to irritate. That forces the body to pump blood harder, increase the blood pressure to properly circulate oxygen and nutrients, and we can actually reduce the bodily rate of aging through moderate and even easy exercises. So regular walking, such as 15 minutes walking every day, releases hormones that help reduce the speed of aging in our body, and by slowing down the rate of aging in our body, we actually slow down the rate of aging of our blood vessels and help to prevent age-related increases in blood pressure. So use exercise to stay young and reduce age-related high blood pressure. The next step is to learn to relax. I've had many patients who had stress-induced high blood pressure, and once we dealt with the stress, the blood pressure dropped naturally, and then we didn't have to use anti-blood pressure pills on those patients. Stress causes adrenaline and cortisol to release, and these chemicals irritate the blood vessels, and they cause the heart to pump harder, and between the two, the blood pressure increases. So we need to learn how to manage our stresses in order to avoid those stress-related increases in blood pressure. And you can do that by taking a few minutes off every day to relax. Perhaps just take a 5-minute holiday every day to just sit down in a quiet space and close your eyes and just listen to your breathing for 5 minutes and not allow any worries to bother you with listening to your breathing. Alternatively, you might need to take a long, hard look at the situations that are causing you to have this excess stress, and you need to find a way to change the circumstances in order to minimize the amount of stress your body is experiencing. But that is another step you can take to lower your blood pressure. Either learn to relax or try and find ways to change the situation to reduce the stress on your body, and that will help your blood pressure to lower. Okay, the next step is to lose fat. If you have a lot of fat in your body, a lot of that fat is going to spill into the blood as cholesterol, and that thickens the blood, making it harder to pump. And also, if you are overweight, that means the heart has to pump harder to supply a larger sort of body area or body volume with oxygen and nutrients, and the heart pumps harder, and that raises blood pressure. In other words, being overweight can cause high blood pressure. So if you can lose the fat, often the blood pressure will fall along with your weight. So you already will be losing fat if you have followed the advice in the previous steps, such as cutting out sugar-containing foods and sugar-containing drinks. So just by cutting out those excess calories, you'll already be losing fat, but you can, in addition to that, reduce your portion sizes and try and reduce the amount of starches you eat, such as potatoes and rice, and that will help you lose fat. The last and final step is to know what is your blood pressure and to control the blood pressure if it's high. Now, take active steps. Either take all the steps I've mentioned previously or go see a doctor and get some blood pressure pills. The reason for that is that high blood pressure in and of itself damages blood vessels, causing them to be stiff, thick, and irritable, and that forces the body to pump blood harder, increasing the blood pressure to supply oxygen and nutrients to the body. So unfortunately, high blood pressure in and of itself can cause high blood pressure in a sort of vicious spiral of increasing high blood pressure. So if your blood pressure is uncontrolled, it's going to steadily go higher and higher and higher. So check your blood pressure regularly. If you have mild high blood pressure or you're starting to see you're getting high blood pressure, either seek medical help from a doctor or take urgent steps to lower your blood pressure using the steps mentioned in this video. If those steps don't work, well, you still need to go see a doctor and get some medication to lower that blood pressure and prevent that blood pressure from spiraling up too high. So monitor the blood pressure and make sure it's fine. So let's review the 8 steps to controlling your blood pressure. Step 1 is to quit smoking. By far, that is the number one thing you can do. If you're a smoker, your blood pressure will usually drop quite a lot if you quit smoking. Step 2 is to drink only water, so cut out the coffee, tea, alcohol, soft drinks, fruit juices, and this water should preferably be distilled or purified water, in other words, sodium-free water. Step 3 is to cut out refined sugar-containing foods. Step 4 is to cut out foods that have sodium or salt. Step 5 is to do some moderate exercise like walking 15 minutes a day. Step 6 is to relax. Step 8 is to try and lose any excess fat you have on your body. And step 8 is to monitor your blood pressure and control your blood pressure. And if you find you can't control it, well then unfortunately you'll have to go and see a doctor and get some blood pressure pills. But except for the last step, the previous steps are all methods that you can do by yourself without requiring any medications, and you can, using these steps, reduce your blood pressure without using any blood pressure medicines, but do monitor your blood pressure and make sure that your blood pressure control regime, whatever you choose, whether it's this method or using medications from a doctor, is actually working to control your blood pressure.